Good afternoon, everybody. Christine Varconi here in the NBC4i Streaming Center. Following up now, I wanted to talk to Representative Jon Cross. He is a Republican representative in the State House. Thank you for joining us, Representative Cross. First off, just want to dive in real quick. What was your initial reaction to hearing the announcement from Governor DeWine that the statewide health orders would be lifted on June 2nd?
Oh, thanks for having me. First, I was delighted. I think we're all excited, thumbs up that the governor has finally listened to the legislature. He's listening to Ohioans. He's listening to Ohio businesses. It is well past time to open up. So June 2nd is the date. Quite frankly, on a beautiful day today, it could be today, but we'll take June 2nd. And if the governor wasn't going to open up Ohio, the legislature was prepared to do so on June 22nd because of Senate Bill 22. But that's here nor there. He's given us the date, and I think we're all very much looking forward to Ohio fully being open.
What specifically, when you say fully open, what specifically do you think was a hindrance, and what did you want to happen to have the state fully open?
Well, most importantly, businesses can operate at full capacity. When someone tells you that Ohio is already open, that's a little misleading because restaurants and bars, movie theaters, stadiums, any kind of venue that welcomes people to their business, could be churches, they have to have a limited capacity. So whether it's 25% or 50%, well, guess what? As of June 2nd, they can now go to 100% capacity. So I'm fully expecting a full stadium at Ohio State for football, or a Cleveland Indians game, or your local church on a Sunday that's fully packed. Businesses, bars, restaurants can bring back their tables and chairs and welcome full capacity as long as we have the workforce to do it. And I think the next step the governor needs to make is send an executive order or call President Biden and say, we in Ohio no longer need the additional unemployment stimulus because people need to get back to work. And I think that's one way to help make sure that we have a ready to go workforce.
Are you going to be comfortable being in Ohio Stadium, being at a concert venue, being at a bar shoulder to shoulder, potentially without masks on, with, as of right now, less than half of the state population being vaccinated?
Yes, we live with risks every day. I mean, if I eat too many cheeseburgers, it's probably not good for me, right? So we live with risks every day. And so we understand that with vaccinations happening and the COVID outbreak slowly coming to an end, it's time to get back to normal. I think Ohioans are ready for it. And I think, the masks, when we say we're going to be fully open, no more masks, no more mandates, no more, social distancing protocols. People as adults can figure out how to handle their situations the best. And if Ohioans want to get a vaccination, they certainly can. It's easy to do so. For people like myself, I've had COVID. I have the antibodies. I'm not ready to get the vaccination yet. I'd like to see it further developed before I do so. And so, I've made that choice. We shouldn't use game show gimmicks to incentivize the vaccination. And I think the thumbs down would be, the announcement was kind of shocking to listen. We're gonna give taxpayer funding away to incentivize vaccinations, and we shouldn't do that.
I'm going to ask you more specific questions about that in just a second. But Representative Cross, do you support private businesses if they want to continue to do the masks required in their store, say Kroger, or if Ohio State University wants to ask people to wear masks inside the stadium, bars, restaurants? Would you support them in continuing their own personal private mask mandates?
As a pro-business Republican, I don't think it's the government's job to overly mandate a business and tell a business what to do. But I'm encouraging businesses to open up, and I'm encouraging all businesses not to do so, because here's why. We, the Ohio consumer, now have a choice. If a restaurant or a grocery store is going to have all these severe mandates, I'm probably not going to go to their store and spend money. I have a choice now. I can go to other places where they have lifted the mandates because we have fully opened Ohio. I'm encouraging businesses not to make the vaccination mandatory for their employees. Let you know, I'm hopeful that businesses can fully open, and we don't have private sector mandates, and that things, our workforce seems to get back to normal, and our everyday life as a consumer gets back to normal.
Do you consider the wearing of a mask to be an extreme measure or just the mandating of a vaccine?
I think mask wearing after we've lifted the orders. I mean, it's if a business wants to do that, that's their choice. But I will not be going to a place of business that still requires the mask.
Okay. So getting on to the incentive program that the governor announced yesterday. So 5 kids getting full tuition scholarships and 5 Ohioans receiving $5 million from this federal funding that has been allotted for public health. You said you weren't in favor of that. Can you explain a little bit more, and why is that, and where would you like to see this money go instead?
Well, the governor has identified using $5 million of the American Recovery Act, which is federal money, which is your tax dollars. It's your money, my money. It's the American people's money, and it's my understanding that the governor is allowed to use money for the promotion of vaccinations. But what they're doing, and I think, is just a unnecessary step. We have to stop giving away free stuff. We have to turn off the federal printing presses and stop giving away free money. I just think it's gimmicky. I'm more happy that we're opening Ohio and letting our economy get back to normal. I think we should end the unemployment stimulus, but as far as the money goes, we're right in the middle of the budget process. There's better ways that we can be spending that $5 million for local infrastructure, our education system, our communities, our private sector businesses that have been affected by COVID. I have lunch at a local restaurant, to put this all in perspective. When I'm in Columbus, I have lunch at a local restaurant by a local eatery, and that business owner said, "John, I've lost $278,000 in my business during the course of COVID. I haven't bankrupted the company yet, but my little sandwich shop is still surviving." It's those folks that we're trying to make sure we're helping. And the best way we can do that is get back into his restaurant, continue to buy his food and sandwiches, have a lovely time, and continue to support our entrepreneurs and small business owners, and not keep giving them free money from the federal government that isn't free. It's our tax-paying dollars. So that's a perspective on what I think we should be doing to help reboost and restart this economy.
So as of this morning, at least here in Columbus, I'm not sure about the rest of the state, 12-year-olds, 12 to 15-year-olds are now available to get the Pfizer shot. How do you think it is the best way throughout the state to get that shot to pediatric centers for parents who do want to vaccinate their kids? And how are you feeling about the vaccination process beginning for these preteens and young teens?
Well, it's not by incentivizing free college. Giving away college scholarships is not an incentive. Listen, I'm a parent. I have an 11-year-old and a 6-year-old. I think parents need to decide what is best for their children. It's that simple. So if parents want to get their child vaccinated, they certainly can have those conversations and do that. As the chairman of the Higher Education Subcommittee of Finance, I don't think we should be giving away free scholarships. We should be looking at these federal dollars to improve the OCOG and SSI scholarships, the as need or need-based scholarships in the state budget. We should look at merit-based scholarships. There's plenty of ways within the higher education space to focus on our graduating seniors who are about to enter college and make sure that they can achieve their career pathways without playing gimmicks onto our health needs of Ohio.
I'm looking up right now because we reached out to, want to make sure I quote this correctly,
Sure.
from Attorney General Dave Yost. So He said, like many of you, I first learned about the idea of the incentives yesterday. At first blush, the concept does not to appear to violate state law, though that would depend on how it is designed. We will continue to review as additional details are made public. Are you at the State House? Are you guys looking into perhaps the legality of this as well? And will steps be taken upon further review if you maybe find out that it isn't?
Well, certainly the legislature and particularly members of the Ohio House, we were not informed about the governor's speech, and we were not informed about opening Ohio, and we were definitely not informed about the incentive money he wants to use. I know several members have called the Speaker of the House. We've had conversations. I believe our staff is looking into the legality of this. I would assume and I would hope that if the governor is going to make this kind of announcement, he has run those traps already. But in any case, I think there's going to be proper oversight given to all this, and we'll see in the next 24 hours, particularly if the governor holds a press conference today, what he'll say as he explains more details. But I would encourage him to just give, listen, everyone can be creative. There's nothing wrong with being creative on ways to market and incentivize things. But I think we should sleep overnight on this one a little bit further to think before we really do this, is this the right way that we want to spend our money? And is this the right perception? Is this the right perception we should do to help incentivize or promote vaccination?
All right, Representative Cross, is there anything else that I have not asked you that you would like to touch on today before we hear from the governor here in about 17 minutes?
No, I think we're good. I think we covered it all. Just please, we're back open for business.
All right, thank you so much.